Good afternoon. I'm Heather Bell, the Acting President and CEO of the Orange County Chamber of Commerce. Welcome to today's edition of Meet the Member. I'm joined by Dr. Adam Silverman, a board-certified general and plastic surgeon. His business is New Beginnings Plastic and Reconstructive Surgery out of Poughkeepsie, New York. Coming up on their 10-year anniversary, welcome, Dr. Silverman.
Thank you very much. Appreciate it.
Happy to have you today. Dr. Silverman, before we get into the specifics about your practice, would you mind sharing with our viewers your qualifications and specifically, if you wouldn't mind, about how being dual certified is such a benefit to your patients in your practice?
Right. So I'm a double board certified surgeon. I'm board certified in general surgery and plastic and reconstructive surgery. What that means is I've basically done a residency in either or both of those, and passed my board exam so that I'm now certified in both. The reason why that's important for me is I've been trained throughout the whole body. Okay, so I feel very comfortable operating on anywhere from the face to the abdomen. I'm fully trained in all those fields, and it makes me feel more comfortable in the operating room. It also is better for my patients because then they have the expertise of someone that's, has all these qualifications.
That would certainly make me feel a lot more comfortable knowing that. So thank you for sharing what that means. The general public really just doesn't understand that. So I like to bring that out right away. What made you start? What made you say, okay, I'm going to be a plastic surgeon? And more importantly, from a chamber perspective, what made you say, I'm going to start my own practice?
What made me become a plastic surgeon is actually kind of interesting. I was always very interested in anatomy. And as a plastic surgeon, everything that I do is related to the anatomy of the body. Where a muscle is, what a muscle does, where the nerve is, where the blood vessels are, all that is so very important as a plastic surgeon. So I was able to basically use bring in anatomy into my practice, and I use it every day of my life in my practice. Reason why I started my own practice, I'm originally from Poughkeepsie, born at Vassar Hospital. I went to Spagginkill, high school, and I wanted to come back to the community to kind of bring information and techniques and procedures that I thought was lacking in the community. And I felt that if I was to work for a bigger group, I wouldn't be able to kind of spread my wings and bring all these techniques in because I think I would have been kind of, not being able to do some of these procedures that I do routinely.
So it allows you the flexibility to choose what you want to do and how you want to do it.
Correct.
Wonderful. And could you tell us specifically what areas you specialize in? I realize that you're a general surgeon, and you can do anything, but are there areas that your practice is specializing in?
Yeah, so really I only do plastic surgery. However, some of that does kind of overlap with general surgery in a sense of, complex hernia repair. That's somewhat kind of overlaps with general surgery, and that's why I feel very comfortable with those procedures. From a plastic surgery standpoint, I'm all over the body, okay, and all sorts of different techniques. That is reconstruction, that is cosmetics. What I mean by reconstruction, so let's say someone is affected by the unfortunate thing of breast cancer. Reconstructing the breast, abdominal wall reconstruction, all types of skin cancer reconstructions. I also see a lot of patients for facial fractures, people that have been in car accidents and have facial fractures. So that's another type of reconstruction. And then there's the whole aspect of cosmetic procedures, which is things like breast augmentations, abdominoplasty or tummy tucks, eyelid lifts. And then injectables such as Botox and fillers. That's routine in my office when I'm in the office. We also offer IV infusions. IV infusions is kind of a name for getting vitamins and minerals into your blood system quicker and more effectively than if you were to take them by mouth.
And you have an esthetician that also works with you, is that correct, in your practice?
Correct. Yes, we have an esthetician. She does chemical peels, facials, waxing. She does a lot of her laser work. So you can do facial rejuvenation, which is basically going to increase the look of your face and your skin, make you more youthful, make the skin more tighter. She also does hair removal with the laser, or like those little spider veins that you have in your legs. She does those also. And then she'll also do cool sculpting. Cool sculpting, non-invasive way of losing fat. And then also, she will also do a procedure called the Vive, which is a vaginal rejuvenation machine. So those are the machines that we have in the office.
Tell us a little bit about that.
The Vive
Mm-hmm.
is a radio frequency technique, basically, that will basically. So let me back up. Actually, patients that usually come for that procedure are patients that are females, and they have something called stress urinary incontinence, which is after they've had children, the pelvic floor gets kind of stretched out, and if they laugh, sneeze, cough, run, do anything, sometimes they leak urine. Obviously, very embarrassing. Something that people don't normally talk to. They won't usually talk to their primary doctor about it. Sometimes they don't talk to their closest of friends. So it's a very private thing. So, but this is something that can help eliminate that. So that's a very effective procedure.
That's very interesting because you don't think of that when you think of plastic surgery. So
Correct.
Thank you for sharing all of those options, but especially that. I hope that helps somebody that's watching.
Yeah, very effective.
There's such a focus on body image issues, and I love that you help people find their confidence. And so give me some kind of an explanation here, though, to say to someone who's interested in maybe like weight loss surgery.
Okay.
As an example, how does that go from a bariatric treatment to a plastic surgery?
Right. So I actually see a lot of patients that have what I usually just term massive weight loss. Now, those are patients that one could have lost the weight on their own through diet, exercise, but there's also patients that have gone through a bariatric procedure that I do not perform. That's someone else that performs that procedure, and then the patients will have extra or redundant skin that sometimes causes rashes and infections, and sometimes they're just unhappy with that extra skin kind of overhanging. They see the results of losing that weight, their body image is improving, but then they have the extra redundant skin. And there's different procedures that we can perform, or I can perform, that can help with those in those situations. Like for the extra skin on the belly, that's called usually a paniculectomy. Sometimes I do a very, very aggressive procedure called a corset body lift, where I'm removing a lot of skin from the front of their belly, under their breasts, and the lower portion of their abdomen. And it looks like a corset. It's very, very, very powerful procedure. Some of these procedures are covered by insurance. Some of them are not. That's something that we can figure out once the patient's in the office, basically.
Interesting. I always find it fascinating to how we're able to change the body. The one thing you can't give us is height, though.
And it's amazing how much. Yeah, it's amazing how much better they feel about themselves after procedures like this, because they've gone through the hard part of losing the weight, and they just want to feel better about themselves, and that's one thing. It makes me feel so happy that these people walk out of my office and they're so much happier because of they feel like they have their body back, and they feel more confident in themselves, and it just increases their general aura of everything.
That's great. There's many things that I learned when I was talking to you through the last few conversations that we've had that have made you, in my opinion, make you, Dr. Silverman, unique. I love that you take the time to know your patients, to ensure that the treatment that they're interested is actually what's best for them. There's so many people out there that'll just do what you want. So I like that you take that time to get to know the patient. I think it also makes you a good businessman aside from having a great bedside manner, but are there areas that you're working that you would think that most wouldn't think of?
So let me just comment on what you said first of all. So one of the things is really cool sculpting. So I see all the patients that come through my door for cool sculpting, the non-invasive way of losing fat. Now, everybody has fat, but not everybody is a candidate or should get cool sculpting. And I've turned people away for cool sculpting because, in my opinion, they're not going to get a good result, and they're basically just going to pay for something and not get a good result. So I personally, and sometimes they're a better candidate for a surgical procedure like a tummy tuck. So then I can kind of shift gears and talk about that and get them on the road of doing a tummy tuck instead of doing a cool sculpting, where they're not going to get the results that they want. And that's the most important part is that the patient is satisfied, they get the results that they want, and they feel better about themselves. So I just wanted to kind of clarify what you were saying before.
It's something that just really makes me gravitate to you, because I feel like there's so much integrity in your business. The fact that you actually turn somebody away. So thank you.
Yeah, the first person I saw for cool sculpting, I turned her away because she was a better candidate for a tummy tuck. And some people just want to have the cool sculpting, and that's fine as long as we have an understanding that there's certain expectations and certain results that we're going to get, but we may not get everything just by doing cool sculpting. So it's important to be upfront with the patient, because it is a machine, and there's limitations on what the machine can do, basically. Getting to your second point, some of the other procedures I do, one of the things that that I see frequently is actually patients that are transitioning from either female to male or male to female, and I'm helping them achieve either a masculine appearing chest or feminizing their chest. And these are people that have been living their lives as a different sexual orientation. Some females are binding, which means basically putting an ace wrap around their chest just to feel better about themselves. And here I can do a procedure and help them masculinize their chest, and it's unbelievable how grateful those patients are, and how we can kind of get them on their roads to feeling so much better about themselves. It's truly amazing.
That's great. Again, another service that you offer that most people wouldn't really stop to think about. So
Correct.
Thank you for educating everybody today. There's a stigma with plastic surgery that it's too expensive, and insurance won't cover it. And we'll get to that in a second.
Mm-hmm.
But before we do, I just wanted to mention a lot of people head out to other countries because of that, and then they come back with complications. So have you seen that?
Yeah, unfortunately, I have seen that very, 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 very frequently, and it's not just a foreign country. Unfortunately, I've seen patients that have traveled down to Miami. I've actually seen patients that have gone to New York City from here, and unfortunately, I don't think people do enough research about where they're going. I think people see pretty lights, pretty websites, and are kind of awed by that instead of really actually researching who the person is that's doing the procedure. Because some of the patients that I've seen that have had complications, and we're talking about serious complications, they haven't been board certified in anything, let alone plastic surgery. They're not board certified in any surgical procedure. That to me is just so scary. And I can't imagine having my loved one go see someone like that. It just really makes no sense to me. Yeah. Just to save money.
Yeah. And you have to think about, sure, is it money? Am I willing to take those chances or pay a couple of dollars more and right, be safe, right? Correct. So let's go to the dollars, because we said we're going to go back to that. Your office, mm-hmm, they work with insurance. Is there financing available?
Right. So again, kind of have to separate the plastic and reconstructive procedures that are insurance based.
Mm-hmm.
The insurance companies will usually pay for those types of procedures.
Mm-hmm.
We will work with the insurance companies on behalf of the patient in order to get those procedures covered. And then there's cosmetic procedures, which are technically out-of-pocket expense because insurance companies won't pay for them because it's not medically necessary to have a cosmetic procedure. Again, those are procedures like abdominoplasty and breast augmentation. So we do offer financing via Care Credit or Alpheon. So those are things that Teresa, my office manager, will discuss when you're in the office.
Teresa's awesome. We love Teresa.
Yeah, she's great. She's great.
We talked a lot about adult procedures. What about pediatrics? Do you work with children as well?
So, I do work with pediatrics. For the most part now, what I'm seeing from pediatrics is a lot of just like lacerations and traumas and things like that. The program that I attended in Chicago, University of Illinois at Chicago, has the oldest craniofacial center in the country. So we saw a lot, and I did a lot of procedures on patients with cleft lips, cleft palates, patients where the face was kind of back and we had to pull it forward, the chin back or forward. So I did, and that's why I feel very confident in all these procedures, because my education and my training was just so involved. It was almost too much. Some of the procedures I did, are not very common, and it's stuff that you just really read about in textbooks and stuff. Those patients usually go to a bigger center, as in New York City or up to Albany. So I don't see those patients as much nowadays. I have done cleft palates here in Poughkeepsie, but I don't usually see them that often.
I'm so fascinated by our conversations and learning so much about what you do. So I want to ask you, we're a little bit over time, but would you mind taking a question? There has one came through on the comments. Can I read it to you?
Sure.
It says, my eye constantly tears. My ophthalmologist says the situation occurs because my eyelid turns inward and rubs against my eye. He has suggested that I see an eyelid surgeon. Is that something that you would treat?
Usually, I probably wouldn't treat something like that. Usually, would go to an oculoplastic surgeon. That's probably would be my recommendation. There's a lot more involved in the diagnosis of the eyelids turned in. Is it because the muscle that kind of pulls your eyelid up, is that detached for some reason? That's usually more of an oculoplastic surgeon that would do those techniques.
Thank you, Dr. Silverman. I would really like to thank you for joining us today. I really, I've learned so much speaking to you, and I look forward to participating in more of our events. And
good. Thank you.
We can do a question and answer next time. We'll do it again, that's for sure, because I know there's not a lot of members that are interested. So Dr. Silverman and his team can be found at 4 Liberty Street in Poughkeepsie, and he currently practices in 4 Hudson Valley hospitals. Thank you again, Dr. Silverman.
Thank you very much. I appreciate your time.
Okay. And thank you to all of our members for allowing us to continue to support them and their businesses and help them grow. To our corporate partners, our ambassadors, and our board of directors for their dedication and commitment to the mission of the Chamber. Check out our schedule of events at orangeny.com. And I invite you to join us in our inaugural 5K, the Chamber Runs and Walks OC. I'm Heather Bellmeyer. Have a great day.